Hi, my name is Scott. I'm a physical therapist assistant here at North Point Orthopedics, and today I'm going to be talking to you about some neck pain. So before we begin with some of these exercises, I want to make a disclaimer that if you are getting any radicular pain, which is radiating pain down either arm, we want you to come and see the doctors immediately and don't try any of these exercises. So this is our tech, Allison. She's going to be helping us out today. And before we begin these exercises, I want to talk about posture and how it's related to pain. So when we talk about posture, if you want to come on over here to the side, we could see if she makes a bad posture. What's happening is that this upper thoracic area of our back is kind of curved forward, as the neck, I'm going to get your hair out of the way, the neck, you can look forward, it's kind of curved in like this. Granted, we do have a natural curve, but what happens is when she starts to look at a computer or something like that, starts to get bad posture, or if she's on her phone frequently, which will require her to look down, she's putting excessive stress on this neck. So what happens is the muscles up here tend to get very tight and they start to get very painful, and it could actually cause some headaches and so on and so forth. So good posture, what we want to do is we want to squeeze our shoulder blades. We want to sit nice and tall. You can start with the lower back, just straighten your lower back out. That's actually going to help a lot up the chain. She want to roll her shoulders back a little bit, and she wants to bring that neck. Her ears should be almost in line with her shoulders. So that would be up to her to kind of bring that back, bring your chin back just a little bit, and start working on this perfect posture. So there are exercises that can help promote this posture, and we'll start going over those right now. So one of the first exercises we're going to be having Allison do, it's called cervical rotation. So all that's going to be doing is she's just going to be rotating her neck side to side, keeping her head down as best as she could. So when she's doing this, if she's experiencing any pain turning to a specific direction, I'm going to ask her to stay within her pain-free limits. So go ahead, turn left, say you get pain about right there. She's not going to push past that pain. Okay, she's going to hold it over there for about 5 seconds, and she's going to come back to the other side. Remember, pain-free motion, she's going to do this 10 times side to side. So the next exercise I'm going to be showing Allison is how to do a cervical retraction, also known as a chin tuck. So there are some cues that you need to do these correctly. So an easy cue that you could use is bringing in your chin in towards the table. We move the pillow so that you could see how it's going to be looking. So she's going to bring that chin in towards the table without lifting her head. She's keeping that head against the table. Another good cue, if you're having trouble doing that, is just to specifically just give yourself a double chin. As we give ourselves a double chin, we are actually promoting good posture out through here. We're promoting proper alignment of everything, and we're taking actually some stress off these muscles at the base of our skull. She's going to be doing this 5-second hold. She could do it 10 times. So the next exercise we're going to be showing Allison is called scapular retractions, also known as shoulder blade squeezes. So all she's going to be doing is I'm going to instruct her to squeeze her shoulder blades in the back and trying to pinch her shoulder blades together. She's going to hold it for 5 seconds. I'm going to do it. There you go. You see her contracting up here. Holds that for 5 seconds, 10 times. And as she's doing this, she's making sure her head isn't going forward, protracting. She's staying in that good postural alignment up in here while she's squeezing back here. She's going to be doing this 5-second holds 10 times. That looks good. So the next exercise we're going to have Allison do is a stretch for her upper trapezius, which is the muscle that kind of runs over our shoulder. So what I'm going to ask her to do is, as she's keeping her shoulders down, she's going to bring her left ear to her left shoulder to stretch the right upper trap. So she should feel this stretch all up in here, nice and gentle stretch. You don't want to force any stretch. And she could do this 5-second holds 10 times. And if it hurts her, what she can do is just try and very gently stretch it. Find a comfortable position. And notice she's keeping the shoulder down. She's not hiking it up, which is going to impede the stretch. Again, 5-second holds 10 times. So another stretch we could have Allison do is for her levator scapula. It's a muscle that's actually attaches to the base of our skull, and it kind of runs down to the top of our shoulder blade up in here. So what she's going to be doing, it's kind of like the upper trap stretch, but she's going to be turning her head slightly towards that pocket on the left side, and she's going to be bringing her chin directly straight down while she's keeping the shoulder down. This stretch she's going to feel probably from the base of her skull all the way down towards the base of her neck. Okay. Now, if she wasn't getting a good enough stretch, what she could do is she could take this hand, bring it above just like this while the elbow is still kind of in front of her, and very gently pull towards while she's still keeping the shoulder down. And again, if it hurts, you don't want to use this hand. You just want to do a gentle stretch by yourself. 5-second holds 10 times again. Allison, why are you sitting like that? Let's fix you right now. Lower this down a little bit. Good posture when you're on the computer is 90 degrees knees, 90 degrees hips. And what she's doing is that keyboard has to be about shoulder height. If she has an adjustable one, that's good. And the screen is supposed to be about eye level with her. Now, if she's, what she was doing before, she's protracting her neck forward, she's going to cause a lot of stress like we talked about before. And if she's looking too far down, it's going to be putting pressure on the neck just like you're on your phone. So this is good posture. Granted, if this was a little bit lower, it'd be ideal. That's it. All right, so as a disclaimer, if any of these exercises are causing you increased pain levels, we want you to stop and come see your doctor here at North Point Orthopedics, and have a nice day.